Should we have a listen to your chest?
2-year-old Olivia has a chest infection she can't shake off, a routine problem for GPs at this time of year.
What do you do with your mouth?
But in some areas, doctors are so busy that many patients have to wait days or even weeks for an appointment. And new figures seen by Sky News suggest 34 million patients won't get one at all, left to look after themselves, try again later, or to seek medical help elsewhere, perhaps even in A&E.
There used to be days where you could queue and wait outside. Obviously, waiting out in the cold wasn't ideal, and then you would sort of be potluck as to what sort of time you'd then be seen. And obviously, children get bored quite quickly, so sitting in the waiting room isn't ideal.
An analysis of the latest NHS data by the Royal College of GPs shows that 1 in 10 patients who seek a consultation with a GP or practice nurse fails to get one. It predicts that will add up to 34 million patients in England this year. That's a rise of nearly 3.5 million in a year.
People really actually do need to see their GP as soon as possible for the right action to be taken and the right treatment to be delivered. And this is a worry that we do have, that the lack of access to GPs in general practice might be making some problems worse.
GPs now offer 40 million more appointments than they did 5 years ago, but it's still not enough. The college says surgeries need more money to hire extra staff.
According to the Royal College, funding for GP surgeries has been reduced by £9 billion over 7 years. The money is going to hospital services instead. But it warns that there is now a crisis in general practice. It's being brought to its knees.
Hello. Yes.
At this Swindon practice, staff now deal with most patients over the phone. It speeds up care, but GPs warn it's not a long-term solution to soaring demand.
We can't give a gold-plated service to all of our patients on a share of the resources which is dropping so significantly. And if you look at that in bald figures, that means we've had a 25% cut in resources in general practice to look after patients who are sicker, who are more complex, who are taking more of our time and attention, and something has got to give.
But the Department of Health said the Royal College's figures were a complete nonsense based on misleading extrapolations of partial data. It added the vast majority of patients rate their experience of making an appointment as good. Thomas Moore, Sky News.